Hi everyone, my name is Louie Pinkerton and my pronouns are they, them. I am an HIV advocate and will discuss ways to end the epidemic and ending criminal laws against people living with HIV. The human immunodeficiency virus, known as HIV, is a virus that attacks the body's immune system, which without treatment can lead to acquired immunodeficiency syndrome, AIDS. People don't die from HIV or AIDS, they die from opportunistic infections that lead to AIDS-related complications. And AIDS is preventable. HIV is transmitted by bodily fluids coming in contact with mucous membrane, so like soft tissue, like your mouth, vagina, the anus, or damaged tissue, or directly injected into the bloodstream. So these fluids are blood, sexual fluids, including semen, preseminal fluids, vaginal fluids, rectal fluids, and breast milk, despite the fact that breast milk is a very low transmission rate. According to the CDC, an estimated 1,189,700 people in the US had HIV at the end of 2019. Of those people, however, about 87% knew they had HIV. In the same year, 36,801 people received an HIV diagnosis. The number of new diagnoses has decreased about 9% ranging from 2015 to 2019. Because of the COVID-19 pandemic, sexual health services were disrupted. So this rate, going further and looking at 2020 and 2021, this rate may look smaller simply because people aren't getting tested. A smaller diagnosis rate doesn't necessarily mean people aren't living with HIV. It just means they don't know their status and they could potentially be transmitting that. So the most affected populations are young, Black, American, gay, and bisexual men, who represent about 50% of new HIV diagnoses among young, gay, and bisexual men. And this is looking at like disparities of Black Americans are the most affected, gay, bisexual men are most affected, and young people are most affected. So you kind of funnel down, and that is the affected subpopulation. So by providing education, collaborating with other organizations, promoting treatment adherence, and advocating for change in state laws, we can help towards our goal of ending the HIV epidemic. HIV advocates' vision is to prevent all transmission of HIV and end AIDS. In doing so, we need undetectable viral loads for everyone that lives with HIV achieved through treatment adherence. So the US's tagline for ending the epidemic by 2030 is diagnose, treat, prevent, and respond. So as social workers in our one-to-one interactions with clients and other community members, we can work to promote self-care, medication adherence for those living with HIV, safer and healthier sex practices for everyone, encourage condom use, work to destigmatize HIV and its diagnosis, and provide an environment that supports self-confidence and healing. So this looks like educating your clients and your colleagues on the basics of HIV, how it's transmitted, what treatment looks like, who's most affected, and how you can look to bridge those gaps. Encourage your clients and those around you to get tested. That's the easiest thing that you can do, is just tell people to get tested. Interestingly enough, your getting tested for HIV isn't automatically included in your panel for when you go get a regular checkup, and you actually have to ask for that. Providers do not think to do that. There's still the stigma of like someone who looks like they have HIV or they look like they're like an at-risk person, and so it's kind of on a case-to-case basis, when really we should just be asking every single time we get our blood drawn to get tested for HIV. Provide education and other resources for HIV prevention, including encouraging people to use condoms and lube. Specifically, lube prevents tearing and damage to tissue that can increase risk of transmission. And transmission can be virtually 0% if you're using condoms, as well as PrEP. PrEP is pre-exposure prophylaxis, so you can use it if you are an at-risk person, or you could even use it if you're not. But that is 99% effective, and combination with condoms, transmission is virtually completely preventable. There's also post-exposure prophylaxis, and also encouraging clients who may inject substances to use clean needles when injecting drugs, and then also to not share. So making sure you're connecting your clients to where they need to go for treatment. And by that I mean where they need to go to get needles, and not necessarily stigmatizing them using drugs, and just making sure they're being healthy. And then also promoting treatment in individual encounters. So the goal is an undetectable viral load, which can only be achieved through medication adherence. An undetectable viral load means HIV is untransmissible. So that can only be achieved through a daily HIV treatment regimen called antiretroviral, or ART. And additionally, because of the COVID-19 pandemic, again, people's treatment has been hindered by that. So being able to support people in those. So people only think that HIV-specific organizations can support people living with HIV, but HIV affects all populations, and there's just others that have greater disparities. So, start a program at your agency to outreach with people living with HIV to promote treatment adherence while also getting their needs met. So food resources don't really have HIV casework or, testing measures or anything, when, there are definitely people who are food insecure that live with HIV, so being able to maybe meet those needs at the same time. Additionally, organizations can promote telehealth and teleprep programs, specifically during the pandemic, as well as self-testing programs for HIV and other STIs. You can implement a testing program at your organization. You can partner with harm reduction organizations to start a needle exchange program, and, as you can do it individually providing condoms, provide condoms out in an open area and condoms and lube to clients, and also direct them to organizations for clean needles. It's all looking to destigmatize HIV and ways to prevent transmission. So folks might not know this, but when the epidemic started in the 80s, states created laws that criminalized folks living with HIV in various degrees. These laws look like sentence enhancement for people living with HIV, regardless of the crime, and general felony laws. We now know with decades of research and treatment that criminalizing HIV doesn't discourage at-risk behaviors and decreases testing and treatment outcomes, therefore exacerbating health disparities for at-risk groups such as young Black, gay, and bisexual men, those who inject drugs, and sex workers. Under existing laws in many states, the behavior of people with HIV can be criminalized for potentially exposing others, regardless of intent, or even if transmission didn't happen. So that's not required in the state laws sometimes, or most times. So some interesting, not so interesting, really sad. 37 states criminalize the behavior of people living with HIV through HIV or other STI-specific laws. 13 states have maximum sentence lengths of more than 10 years, and some states even up to life, even though people living with HIV might have taken measures to prevent transmission. The other end of some supportive measures, 9 states provide defenses for taking measures to prevent transmission. So if someone they use condoms and they have an undetectable viral load and are using PrEP, that can be used in their defense to not criminalize them. But only 9 states. So HIV is a protected status defined by the Americans with Disabilities Act. So advocates can use the ADA to challenge and repeal state laws by filing ADA complaints and going to the Supreme Court. As individuals and organizations to go up higher can contact representatives to propose amendments and, repeal HIV-specific sentence enhancement and general felony laws used against people living with HIV. And a really notable example, recently in June, Illinois repealed their criminalization law. And this is an example of using individual and organizational power. Illinois recently became the second state in the U.S. in the past 27 years, the first state being Texas in 1994, to fully repeal HIV criminalization law. NPR author Valentine writes that Illinois State Senator Robert Peters, who represents Chicago's predominantly Black Hyde Park neighborhood, sponsored the bill to repeal the state's criminal penalties for HIV transmission after a conversation with activists from the Illinois HIV Action Alliance. So that Mezzo, the group HIV Action Alliance, had a conversation with somebody higher up in power to propose legislation. And additionally, the director of government relations at the AIDS Foundation in Chicago, further pushed for this decriminalization. So we have more power than we think as an individual and with our organizations. We can push for policy change, as we are learning in our other courses, but specifically with HIV, knowing our state laws and pushing to repeal those, to for more supportive laws to increase testing, treatment, and prevention. To conclude, I want to remind the audience that we all have a stake in ending the HIV epidemic, and we all have the power to do so. By providing education to clients, collaborating with other organizations, promoting treatment adherence, and advocating for change in state laws, you too can become an advocate for HIV prevention and care. Thank you.